Hey, I'm Serenity and this is my channel, and today we are joined by Nova, Nebula, and Ginger. Welcome back. Today we are going to be discussing why I have a tube in my eye. Random? Maybe. Since this channel was created 7 years ago when I started high school, I knew that I would talk about my chronic illnesses and like surgeries and stuff like that I've been through to be kind of like a source for anyone. And my video on my trombolyar fracture I did in January, February has gained some traction. A lot of you can relate to it in some sort of capacity. I did not know that many people had ankle surgeries, so I thought this would be an interesting topic. I was actually supposed to make this video literally the week I got injured with my trombolyar fracture, so full circle moment. So I will be getting closer to the camera to show you the tube that is in my eye permanently. Well, I can take it out. A doctor can take it out, but it's in there. This time I printed out all my notes. I don't have a lot of notes compared to my trombolyar fracture because this has been going on for 7 years now coming up. I got my first one in my eye when I was 16 and I'm gonna be 22 this year, so 6 years. The issue has been going on for 7 though. So it's gonna be a little more sporadic, not as organized as that video. Grab a blanket. This one is Garfield I got from the movie theater. A snack, a drink, and let's get into it. So to start, I have something called Ehlers-Danlos syndrome. I have 2 versions, but the version I'm going to focus on today is called hypermobility. I was diagnosed with it when I was 15, so 6 years now. Basically, it affects everyone who has it differently, but it is a connective tissue disorder where I don't have enough collagen in my body and my skin is pretty thin, so when I lift up my hand, I can pull the skin out. That's not normal. You shouldn't be able to do that. And anytime I break something, I can now pop it out without pain, so that's normal, that doesn't hurt. I can pop my shoulder out, I can pop my elbow, I can now pop both ankles that I've injured. Certain parts of them I can pop out on a whim. The collagen in my body is not enough and I have elastic skin, so it causes me to be prone to more injuries and, well, it can affect daily life. It's easier to get injured. There's more things to it, but that's just like the basis. So that relates to this. This has been going on for a lot of years, so pardon me, but in 2018 I was going into my sophomore year. It was summer and I remember specifically being at my cousin's quinceañera in July. I've been dealing for ages with leaky eyes that are not tears, but my eyes would just leak. So I remember that I was at my cousin's quinceañera and my left eye would constantly tear, but I wasn't crying. But it was a hot summer night and I kept just like wiping my eye nonstop for hours on end. And that's like the first moment in time that I was like, okay, we need to go see a doctor or something. Now it happened in the past because I remember in the 2nd grade on the first day of school, my left eye kept leaking and my teacher asked me like, are you seriously crying? And I was like, no, my eye's just leaking. And like, that sounds like a lie, but it really is the truth. So I went to my optometrist because I wear glasses basically full time. So I went to my optometrist and I was like, hey, my eye is leaking. Who do I need to see? Like, do you recommend someone for this? Because it's getting to the point where like, it's disrupting my daily life. And he sent me to this specialty doctor. I don't know what kind of eye doctor they were, but they were some sort of eye doctor. And I just kept getting the runaround. It was 3 months of my life. I want to say until September, October of 2018, from July to then, of this doctor. They thought that you have tear ducts, and he would stick a needle this big down my eye, the tiny little hole you have right here of your ear duct, stick it straight down to flush out the wound with some sort of liquid. And if it comes out your nose, he was like, okay, it's clear, you're good for now. And it'd always work on this side, but this side it would get stuck. So they're literally putting eye drops in my eye nonstop, shoving liquid down my eye, and just like trying to fix the problem. Because the way when you cry, the way it works is your tears can come down your nose from your eye because they're connected, and you can usually taste it in your throat. It's all connected, ear, nose, and throat. So that's what was happening. But it was just a waste of my time because I kept saying, no, this isn't working, you're wasting my time. So finally I was fed up with this doctor. The doctor was really rude and I would have to wait like hours on end just to see him for 20 minutes. And we kept doing the same thing over and over and it wasn't working. Like just shoving this needle down my eye, basically having a mini surgery. Finally I got to the point that I'm like, okay, I'm done. We're gonna go to my ENT. My ENT, I had not really seen him much. He had done my tonsils when I was in the 4th grade, so it had been like a good 8 years at this point since I'd seen him. He would on occasion test for my allergies, an allergy test, that sort of thing. I was like, okay, I'm just gonna go to this ENT because when he did my tonsils ages ago, he was great. So I go to this ENT and I'm like, hey, this is what's happening. My left eye is leaking uncontrollably. My right does it on occasion, but the left one is doing it nonstop and I don't know what I need to do. but I need to get it fixed. And then I told him, well, I have early downloads, and went through my medical history. He knew exactly what was wrong. I printed out this whole diagram. So basically you have the inner corner of your eye, you have a tiny, tiny, tiny hole, and that is when you cry, your tears flow through it and can come out your nose, okay? Or when your eye is just watery, that's why sometimes your nose just drips clear after you sneeze a lot, that sort of thing. And it's called a lacrimal punctum. Basically a tiny, tiny hole that drains your eyelids. Every time you blink, a thin layer of liquid is placed on your eye, or when you're dehydrated, your eyes are dry. It's usually because you're running low on that liquid. It's like windshield wiper fluid for your eyes. So that's why usually you have a runny nose after crying. So what was wrong is basically the hole that my eye had was not big enough for the tears to flow properly. So there is a surgery that is called a DCR, or I'm gonna put it on screen because there's no way I can say that. The doctor just told me to call it a DCR because that's what it is. And it's basically a surgery where they place this micro plastic tube in your eye. They go up your nose, they string it through your inner corner so it goes back into your nose, and then they tie a little knot like right here. There's two versions that they can do that. They can just go in your nose, thread it through that little hole that's there and back out. Or for more severe cases, they shave a little bit of your nose in here to make a bigger pathway. For the first couple ones of these, I just need the first option. And it's basically creating a new path between your eye for those tears to flow so you don't get watery eyes like I was getting. It seemed like I was crying nonstop. And it's usually because for some reason or another, your tear duct become blocked. The tube usually stays in there for 3 months, then they take it out and then you're good. Some people, they need to get it taken out every 3 months and replaced right away to keep that, but that's a rare circumstance. And others, they leave it in for a couple months and take it out, and then a couple years down the line they need to do it again. It's kind of rare, but it's not like an unusual surgery occurrence. So that's what I needed to do. So I got my first one done in December of 2018, and it was pretty scary because I had no idea what was going to happen. I went to a day surgery, so I knew it couldn't be that serious, so I wouldn't have been hospitalized. It was a routine surgery. I went in, the tube was put in, I was fine like the day after. I think I still have some footage from this, so I'll put it on screen. I have a lot of vlog footage from over the years. I don't know what I'm going to be putting in this video because some of it's like really cringy. I was fine. 48 hours later, I was back to normal activity. Of course, they have to put me to sleep, so you feel the effects of anesthesia, but I was fine 48 hours later. No pain, no nothing. So 3 months later, the tube was taken out, but it began leaking again. So I went back to the ENT because we had discussed this in the beginning to get another one put in. It was routine, and he thought, okay, maybe we're just gonna need to do this for a year or so, and then you're not gonna need the tube anymore. Your eye just needs more time to get used to the tube to make your eye duct bigger. 3 or 4 times at this point. And fast forward to the Friday before my junior year of high school and right before the pandemic, I go back in and I get another one of these surgeries. We had established at this point, you know what, for the next couple years, you're probably just going to need the tube in and out of your eye right away, because every time we'd had taken it out, right away it would need to be replaced. So it usually would take it out and then try like a month or 2, and then if my eye would leak, we'd go back in and do another one. It was a really simple surgery. At this point, I had recovered. The next day, I was like fine. I would spend maybe 24 hours on bed rest, then I was fine. It really didn't hurt. There was just like some eye discomfort, kind of like when you cry too much. There's pain, small discomfort. That's all it felt like. It was really easy. I didn't have to take any pain meds after. So the Friday before my junior year, I went and got the surgery. For some reason, this surgery was really painful, so I took the first week of my junior year off. Then in October, I was getting dressed in the morning for school, and the tube had just popped out of my eye. Like a loop of it had been pulled out of my eye in my sleep, and I had woken up and I was like, okay, this is crazy. So I called my mom. Well, she was obviously in the house, but I called her and I was like, hey, the tube is in my eye is sticking out. I was like, what do we do? So I had thought, you know what? I can't see because the tube is literally sticking out of my eye, a loop of it. I could see it, so I can't see, and if I close my eye, it hurts more because the tube is laying on top of my eyeball. I cut it. I cut it with a pair of scissors. I was like, okay, I'm gonna chop it here. That way the 2 separate sides can go. Then we rushed to the ENT. But this was not my ENT. My ENT was not working that day. So I saw another ENT. I did not like this ENT at all. This doctor, don't like him. He's not very good on bedside manner. And for 2 hours in the office, we were in multiple different exam rooms, fully laying me down on a kind of like a dentist chair, looking for the tube, looking up my nose, trying to find the tube. And after 2 hours, we're like, okay, we can't find it. This was super, super, super painful. We had decided it probably fell out because these tubes are tiny, tiny, tiny. I would say they're like the size of 1 millimeter bracelet string and maybe 1.5 to 2 inches long. You can imagine how thin they are. I also should mention that when they take out the tube, they do it in office. They usually take it out in office. Literally, they use the alligator scissors. They open your nose wide, they stick up a camera up your nose, and then you just cut it with the alligator scissors. It's really simple. It takes like 2 minutes. It hurts kind of. They'll numb your nose and it hurts a little bit just because your nostrils being stretched, and it's a weird feeling having something all the way up your nose, like up here. But it takes like 2 minutes. So we were trying to find it like that. We couldn't find it. Then we were just like, okay, we don't know where the tube is. It probably fell out. It's not gonna harm you. It's medical grade plastic. You're fine. So I went home. So this was early October. We knew since this tube had not been in my eye long enough that it needed to be, we put another one in on Halloween of that year, and that was then taken out the following year in April of 2020. Right as the pandemic was starting, I had to take a COVID test to go to this appointment, and the tube was kind of just left out for a couple months, and it seemed to be working. We would have put another one in, but of course the pandemic hit. But then around summer again, my eye was leaking pretty bad and I had to get into the doctor, but again it was COVID times, so I couldn't see him until October 2020. Had to test again to go see him, and we decided we need to put another tube in my eye. It had been so long that the hole it created was no longer working, and I just needed to get another one and put in my eye. So what are we up to, like 4 or 5? I've had the surgery 8 to a dozen times. I can't keep track. I definitely don't have it like 4 times a year anymore, but I've had it a lot. So we put another tube in October, and then I didn't get it taken out till October of 2021. And then we put another one in. We just kept doing this. We kept doing this like every couple months. So in April of last year of 2023, the tube we decided is just not working. Remember how I showed there was 2 options we can do it. They either cut bone cartilage or they don't. We had just doing without bone cartilage at this point, and I had been leaving the tube in longer. You can leave it to like 6 months. You don't really want to push a year or so with the tube in your eye, but nothing bad is going to happen. It's just the hole it created is just going to stop working. That's literally it. So think of like when you pierce your ears, the hole closes when you don't keep earrings in there. So that's all it was. Or when you leave earrings in for too long, they're kind of like crusties start to form around it. That's what was happening. The hole was shrinking even with the tube in because it just wasn't serving its function anymore. This is where early diagnosis comes in. So again, with that ear analogy, my ears, I had them pierced when I was an infant. You know, in Mexican households, they do it like when you're a baby. But due to ehlers-danlos and a couple other conditions, my ears don't respond well to any sort of metal that is not like medical grade steel, any sort of piercing. So we tried 24 karat gold, platinum, everything. If it's not medical grade steel, my ears start to get infected. But in the 21 years I've been alive, I think we stopped trying to put earrings in me when I was 1. The holes in my ears have never closed. I can put an earring in my ear right now, and that's because of ehlers-danlos. You heal a lot slower, and sometimes when you put holes in your body, they will never close again, or they scar really badly. That's how ehlers-danlos works. So my ears never closed, and we knew from this procedure, after having done it so many times, that at this point I'm probably gonna have the tube in my eye for a very long time, probably for the rest of my life, just to stop the tearing from happening. So during this time I had to start wearing my glasses more because it was also worsening my eyesight. Imagine literally wearing your glasses and constantly having tears come down your eyes, having to swipe up. It was hurting my eyesight more, and these are actually super dirty. So I started having to wear my glasses more, but then I would have the tearing, so we just had to keep the tube in for my eyesight. And I couldn't wear contacts because of the tube, because if the contact were to slide under the tube, that could be in a horrible place. So we decided in April of 2023 that the way we were working, we were doing the surgery, my doctor loved this doctor who was like, we can continue doing it, but there's one way we can try. And you can leave the tube in for a lot longer, though we are going to want to keep changing it out every 3 to 6 months, pushing more to the 6 months. But you can leave it in for up to 14 months, which is great because with college and everything, it's harder to make time for these sort of things. So in April 2023, we're like, okay, we're going to go with option number 2, the surgery where we are now going to cut a hole in your bone, in your nose, your cartilage in your bone. It is what is more commonly given to people. You were so young when we first started this, we didn't want to do it, and if usually it's more reserved for more severe cases, and we got away for so long with just doing option 1, just threading the tube through your eye without cutting anything. Now we are going to have to cut a micro hole in your bone, in your nose, and it should be able to create a larger hole in your eye, and that way you can leave it in longer and it probably work better. I hope this is making sense. If it's not, I apologize. I'm trying to explain this to the best of my ability, hopefully by popping some sort of pictures on screen so it's easier to see. Maybe the pictures on screen are helping you. I'm trying to do this to the best of my ability, but it's really hard to explain. I'm a regular at this point. The doctor, he tried to get me in as soon as possible, but my insurance kept pushing it back because I had to get approval for the drilling of the hole in my eye, something they had not had to do before. And since they were going to be doing a more invasive surgery, I had to get other clearance from my other doctor. I talked about this in my tremollar fracture video, but I have multiple blood disorders, but the main ones are von Willebrand's disease and hemophilia. Basically, I don't have enough platelets, my blood doesn't clot properly, I bleed a lot, and I don't have enough red or white blood cells. That's kind of the gist of it. So I bruise easy, I bleed a lot, so I had to get approval from my hematologist for this. And the reason why is because they were drilling in bone, it can cause bleeding. With that, I need something called factor 8, and factor 8 is basically a IV drug that is given whenever I have any sort of heavy bleeding episode, such as my menstrual, a bloody nose, a major bloody nose. Like when I get a blood nose, it doesn't last 20 minutes, it lasts an hour, that sort of thing. And it just promotes blood clotting. So I had to get approval from my hematologist to do the surgery, and then I had to actually have this surgery at the actual hospital. But something they don't tell you is when you have medical issues as a child, usually your doctors will not release you until they absolutely have to. I needed to see this doctor because he didn't want to release me until I had moved out of my hometown. He had been doing my care since I was 11 when I first discovered I had blood disorders. So I had to go see him, I had to explain the situation, and then he had to give the approval. But with his approval, any sort of surgery I needed to have in his hospital, because if something goes wrong, he's there. He's only a couple floors above me to come down and like fix the problem. So this happened when I had my wisdom teeth out, when I had appendicitis, when I had stomach reconstruction surgery for a stomach issue I had that I'm now in remission for. I've had multiple surgeries in this hospital. I've been an inpatient in this hospital in the PICU for when I gave myself a 2nd-degree burn on my foot accidentally, when my appendix bursted during the pandemic. So the paperwork and the insurance, it kind of worked a little harder because one, I had to get approval from a hematologist for them to approve the surgery, and second, I had to get the approval to have the surgery in the hospital because no longer is the insurance just covering like a day hospital sort of thing. Now they're covering a operation OR in a major hospital sort of thing. That took a while, and finally surgery was set for June 6th of 2023. So I had to get a pre-COVID test. You know, you still have to do that for any sort of surgery to make sure I was good, and then I had to register and do all of the shebang. So I got out of this surgery. It was like 20 minutes more than the normal time. It's usually a quick surgery. It takes 20-30 minutes once I'm in the OR. And what I will say, I've had this surgery so much that I'm so used to like bouncing back in 24 to 48 hours, not having to like do any special sort of treatment or anything, take pain meds or anything. Done the surgery so much. Once they got so mad at me for having my nails, acrylic nails, that they had to put heart monitor on my toes. So if you ever have acrylics and they get mad at you, no, they can put the heart monitor on your toe. 2, another time they lost my chart, completely lost my chart. So I was sitting in the OR day room for like an hour extra because they couldn't find my chart. And the chart was in the recovering patients, not the patients that are waiting for surgery. 3, once they lost my pregnancy test. That happens a lot for some reason. And then 4, because I have these weird sort of medical issues, they love to bring in students when they know I'm coming in to watch, to try putting the IV on me, to see the weird scenarios, which I don't mind. I think it's really fascinating and hilarious because if I can be a tool for you to learn, go for it. But many times when I let them do their IV on me, they always miss. So that hurts. But the difference I recognized from this surgery, now that they had drilled the hole in my nose to last surgeries, is it took me about 4 to 5 days to recover. There was a lot more nose pain, specifically right here because this is where the tube is, and if you look closely, my nose on this side is slightly thinner than on this side because they shaved this side down. There's a hole in here. The pain was pretty bad. I had to take over-the-counter medicine. I could not wear my glasses, which I wear my glasses pretty much all day unless I'm literally filming a video or on rare occasion out and about. I'm finally looking into getting contacts again because I think my doctor will approve it. Even though the tube is going to be in my eye for a very long time, we're going to have to keep getting them replaced. I just think contacts are going to be better for me, but I couldn't wear my glasses. So I pretty much stick to the same kind of glasses style. And the little these that rest on your nose were hurting so bad anytime I put them on. So I would take, it was really hilarious, I'd take like a Kleenex and fold it up so that the Kleenex was like a kind of like a barrier. So my glasses would sit like this and the Kleenex would lay like that so I could wear my glasses without the nose pain because it really, really hurt to wear my glasses. On the exact area where they lay on my face was the exact area they had the hole. I also noticed I couldn't sleep. I had to sleep at basically like sitting up because laying down the pressure was too much on my nose. So that was a real difference. I was so used to like just going to sleep and then waking up the next day fine or almost fine, and then the next day after I'd be totally fine. So I also couldn't work on my computer or do anything on my computer because it just hurt to look straight ahead. I was also for the first time put on a lot of antibiotics because they shaved my nose. There is bone fragments that were still coming out basically. I definitely feel like I got my shit rocked today. This is not the worst after surgery look, I guess. I really could get my camera out because it's in my room, but I don't even have the energy to do that. I didn't really sleep last night. I definitely still have the little smiley they put on me, and then you can definitely see the tube now. It was crusty, dusty, and gross and bloody, and my nose is bloody too. My skin looks dull. I feel like I gained 20-30 pounds overnight. I'm super bloated. Feel like I'm gonna throw up. Feel like I was hit by a truck, and I had to sleep at an angle like this because if I lay down flat, I definitely felt like the water I was drinking throughout the day was about to come back up for good. You know, it was not cute. They do this so they make sure I'm doing the right eye. I definitely told the nurse on accident it was the opposite eye, which would have been fun. Gotta be careful. It definitely feels like I have an eyelash in my inner corner of the eye, and I also can't like widen my eyes because it feels like a stretch there. It doesn't necessarily hurt. It's a little sore. It was definitely bloody last night. My hand didn't actually bruise at all, but they did use a really big needle. I think it was like it was blue, so I think that's a 21 gauge. Also, something I haven't talked about like at all. So usually after every single surgery, I have something called daily nose rinses. I haven't always been the best with them because I don't like doing them. Basically, if you've ever had sort of like sinus infection or stuffy sinuses, you use like a neti pot. So you put specialized water up your nose and then you tilt your head and it comes out the other side. I had to do that every day. 3 times a day for all my past surgeries. For the past surgeries, it'd be like, okay, you only have to do it for 2 weeks and then you're good. And just use a nasal spray as needed. I don't like putting things up my nose. They do that so like all the gunk, you usually get like mocos to keep it nice and clean, keep the area clean, because keep in mind the tube is literally right here. To keep the tube clean, it's a medical instrument, it needs to stay clean. So for this one, I had to do those rinses for a month, technically 2 months, but then I got injured with my foot, so I stopped doing them completely. I've been fine. Every day, 3 times a day, waterboarding myself, hate it, and using a specialized nose spray. And it's just to keep the tube nice and clean. It makes sense. I just don't like doing it. And you're not supposed to blow your nose at all for at least 2 weeks. Every single nose rinse, I'd have bone fragments coming out of my nose. There's no weirder feeling than seeing fragments of your bone pop out of your nose. The rinses are to keep the area nice and moist so you don't have a nosebleed. So you guys didn't see me do this yesterday, but I did. I have to do this 3 times a day. It's like a neti pot to clear my nose, if you know anything about that. Here comes the fun part. I need to get down to there. I hate this. So the point is the water needs to come out the other end. Kind of coming out of my eye a little, watering it. I'm allowed to blow this side, but I'm not allowed to blow this side. I'm done for the next couple hours. I have to go through one of these every single day, like the full 240 milliliters. I also noticed with this surgery, I could only sleep for 4 hours because I was literally sleeping, sitting up. I don't know. I feel like this was just a jumbled mess. Hopefully it makes some sort of sense. Hopefully you learned something. Also, don't take your eyes for granted if you don't have this problem. It's really annoying when people think you're crying and it's like, literally, it's not even allergies. I can't control it. I would also notice that like when I tried to cry, because this problem happened, I didn't have tears left to cry. But those are basically all my notes on this surgery. It's coming up on a year since I've had this tube in my eye. I probably should make an appointment with my ENT. Would kind of come to this understanding that it's like, I'll get to you when I get to you, sort of thing. The tube still works. I don't tear up. That's why the tube is in my eye. It's literally to redirect tears the right way. It sounds like such a small detail, such insignificance, but it really affects your life when you cannot control it. Like if your eyes have ever watered from smelling something spicy or something that smells bad, that uncontrollable feeling, it would happen nonstop. And that is just something you deal with when you have medical issues like Ehlers-Danlos. It's these weird things that you don't think about, medical issues you're gonna deal with, because if you would have told me at 14 before I was diagnosed, you're gonna have a tube in your eye for probably the rest of your life, I would have been like, you're crazy. But now I'm so used to it. It doesn't feel like anything is in my eye. Like I don't even remember it's there unless I'm literally doing my makeup and I'm like, oh yeah, you're in there. Also, when the tube is out of my eye, I notice it. I feel like there's an empty space, like something's kind of missing, kind of like I have an eyelash right here. When they put a new one in, it's only like a disturbance for 24 hours. It feels like I may have like scratched my eye. That's it. It doesn't hurt. But because of early downloads, the hole that they construct will not stay open. So the only way is to keep the tube in my eye, usually at all times. It's a weird detail. It's a weird thing to experience. I'm sure you're watching this and you're like, Serenity, what? Why? I know. Who would have ever known there's a surgery for this? It's not like a super common surgery, but it's common enough to have a surgery dedicated to it. So that is why I have a tube in my eye. It's a really funny story. People get really freaked out when they see it. Obviously, you've known me. At least I've been doing this consistently for 3 years, but I've started this channel for 7. The tube has been in my eye that whole time, basically since I started this channel, maybe a year into it. You never noticed. You probably will never notice because obviously it's a clear plastic tube and it's so small. It doesn't bother me. It helps me. And going forward, the surgery, hopefully now, since the bone fragment has healed, they will continue to thread it through the nose. So hopefully it doesn't hurt as much. Maybe I'll take you along for my next surgery because that's probably going to happen over the summer. Maybe that'll be interesting to you. Maybe I can explain it better. Let me know any weird questions you have down below. Don't forget to like, comment, and subscribe if you want. I'm going to continue to post these sort of life with chronic illness stories. Let me know if you want to see one on story of how I burnt my foot, my appendicitis, my stomach surgeries, all the weird ones that I've had. My socials are linked down below. Follow me if you want to. And as always, as a palette cleanser, the doggo picture of the day is this picture of Capella. I have a bench in my room, like a reading bench. The dogs love looking out the window, laying in the sun, so they don't have to be outside because they live in Texas, and just hanging out there. It's a picture of Capella lounging around, but I took that picture at like 7 a.m. before I like fully opened the window for her to look out, so she was ready. That's it. That's all I have for you. Love and mean and kisses. Don't do anything stupid, and I'll see you next time. Bye.
I know you told your friend you're not okay. And tell me what's wrong and why you never said you felt that way.